we have Dr. Sabina Stan. Sabina, if you'd like to take the floor.
Yeah, thanks, Sharon, and thanks, Sharon and Pat, for she's not yet here, I think, but tell her I said so. It's a great idea. I think it's why didn't we think before? Maybe the online format, it's a bit easier to organize, I wonder.
Yeah.
So good, well done. Footnote. I was wondering if postgrads, however, do not also need some kind of in-person meeting. You know, we all crave, and we are, you know, I was teaching yesterday and it's kind of packed.
Yeah.
You know, in a classroom. So I was wondering if, you know, a bit more distant.
Well, I suppose if I can come in on you, Sabina, there, this talking research that Pamela and I have launched, if that be the right word, is as it's only as good as much as the word we can spread. So we have already done 2 very informal sessions introducing ourselves as postgrad. Well, Pamela is to support them from connecting with other networks, connecting with like-minded supervisors, sharing information under the track, and whatever that support they require. So we're picking up a little bit of momentum, and this was just a new initiative. So again, I'll be popping it out on that loop page called Talking Research. So as much as primarily it is staff that is on this call today, it is a great opportunity for us to say, look, this is what we're doing, promote it, share it, word of mouth, all of that, etc., etc. So, and Pamela is there to support them in a very overall view, not specifically about their subjects, just purely about trying to connect with people. So, so yeah, keep spreading the word about Talking Research and we'll get there.
Great. So in terms of myself, so I'm Sabina. I've been in DCU now since January 2006. So for some time now. I'm by training a social and cultural anthropologist and sociologist. I've been trained in Romania, France, and Montreal, where I did my PhD, and then a postdoc that was in an interdisciplinary group studying health, combining social medicine, as they were called, or I think maybe public health could be called in English, and health management, so health systems. And then I came to DCU, and I'm teaching in this area, so sociology and anthropology of health. And Sharon, we can go to the next page. At that time, I was already interested in healthcare reforms, and most specifically in privatization and marketization of healthcare. And I was, I think in the end, you know, for me at least, my research questions are also my personal questions, my questions about myself, the world we live in, and why is it so? And I was coming from a communist country with a universal healthcare system. I was wondering why and how come that private healthcare has been presented more and more as the solution to the problems of healthcare systems, hence the interest in healthcare privatization. And then the other question, which I started at that time, you know, 2006, it was still the Celtic Tiger, and migration was a topic in Ireland. Money was flowing in research and in migration research particularly. And I turned my attention to mobility, let's say, more generally, the access of migrants to healthcare, both in the host country and in the country of origin. And also, I'm interested more largely in healthcare worker mobility across border. And also, this is, you know, again, it's a personal interest, because only yesterday I was trying to see if a prescription made by a doctor, a GP friend in Malta, would be available here. It would be, how you say, serviced, or, you know, and it is. We do have European-wide policies about this mobility of healthcare. From there, you know, so I'm having this kind of European transnational approach, and in the last 5 years now, almost, I've been in a larger project on EU governance of healthcare, meaning basically European policy in healthcare and its role in healthcare policies in Europe since the financial crisis. And in this project, in which I have been seconded, this is the fifth and final year, we've been looking at this European governance of public services and the reactions to them on the part of trade union and social movements, because basically why there is a circle there from privatization to privatization, and the first and last points on the slide is because this governance actually is pushing things towards privatization and marketization. So the last slide, Sharon.
Yeah. Sure.
Just some examples of some of my publications and more recent publications, and they are both about this transnational European dimension of healthcare. The one from the right, on the European healthcare system, and the one to the left of the slide is about the European health insurance card, which most of you, I hope you have, as you, I think, used to travel before COVID around Europe. And in the project, we are currently preparing a book on European governance of public services with the Cambridge University Press. And that's for me. Thanks.
Great. Thank you very much, Sabina. Lots to take in, as you can see. We have a great selection of topics from our researchers here this afternoon. So I think it's going to be a great presentation to circulate to people, so that people are understanding the work that we're doing in the school.